And then our goal is to begin treating GABA-A2 loss of function kids in spring of 2027.
Hi everyone, Monica from Cure GABA-A. I just wanted to jump on really quick because we have some very exciting news to share with the community. If you've been following along with us, Cure GABA-A has been funding the GABRA1 and GABRG2 proof of concept messenger RNA protein replacement therapy. And this has been going on in mouse models. And so just to give you a quick recap, we found GABRA1 and GABRG2 modified mice that we purchased, flew in, held in the vivarium during quarantine, dosed with the therapeutic over the course of 3 weeks, 2 weeks of dosing, 1 week of observation. We took a look at all of the data, and we have now compiled enough data to present our proof of concept to the FDA. So we are at the stage where we are writing a pre-IND. This is where we actually reach out to the FDA and we say, here's all the data that we've worked on. This is our theory, and we would like to move forward. What do we need to know from you today in order to move this drug forward? The most common response is something called a toxicology study. And essentially in this toxicology study, it is a large cohort of mice. We test the therapeutic, we figure out what the dosing regimen is, and really just making sure that it's safe. After we receive that data, then we will go back to the FDA and submit something called an IND. So we're currently submitting a pre-IND, later we will submit an IND. So we have an update from Thomas Temple, who will share the information in a moment. But I wanted to let you know that so far, Cure GABA-A and the community of Cure GABA-A has been funding this therapeutic. A large portion of the funds have come from Alessia's family. So we are so grateful for all of your support in making sure that this drug is funded. Now, we have the next milestone payment, which is coming up. It's going to be about $250,000. We're going to break that down into segments. And so at the end of this month, we will be submitting $50,000 to Grand Pharmaceuticals as payment. We need everybody who has a loss of function child to help us raise these funds. If we don't raise these funds, we cannot pay for the continuation of the work, and therefore this therapeutic will be shelved. We have moved at such a momentous pace. We are so lucky in every opportunity that has come forth to us, and we just keep moving forward. We urge you to help us continue this project. So without further ado, I will pass it on to Tommy to give you an update.
Hi, Cure GABA-A community. I'm Tommy Lyle Temple. I'm the president and CEO of Grand Pharmaceuticals. Recently, we finished our GABRG2 animal study, where the purpose of the study was to determine whether an mRNA LNP for GABRG2 would create the protein and be safe in a mutated mouse model. Now, this mouse model was loss of function. Gain of function will be in the future for us. The study went very well. The overall goal was to detect the protein expression and see the safety, which we did. There were no adverse events in any of the mice. There was no negative signs in any of the blood reports. The mouse model we used, as I mentioned, was a loss of function for GABRG2. The schedule of dosing was over 21 days, where the mice were treated for 14 days, every 48 hours in those 14 days with a week of recovery to make sure that any elevations in cytokines or expanded toxicology or CBC were seen. There was no negative impact in any of those markers. We are currently putting together a pre-IND package to send to FDA to allow us to continue into a beginning N of a few trial to begin treating the GABRG2 loss of function children. We were able to detect significant expression of GABRG2 in the brain. The pre-IND should have immunohistochemistry images in it, so you can actually see the expression in the brain, as well as ELISA data showing the overall expression as well. So this is very encouraging for us going forward. We really believe this particle can do some good in the GABA-G2 loss of function kids in the Cure GABA-A community. So in terms of next steps, as I mentioned, we are putting together a pre-IND package that will be sent to FDA. It will be the first communication with FDA for the Cure GABA-A community for our mRNA LNP coding for GABA-G2. This meeting will have us ask them questions about the larger toxicology study that's to come. This larger toxicology study will be about 100 mice. It'll be in the same dosing frame where we'll also ideally look at some seizure counts and some more efficacy as well as overarching safety and basically more data about the particle and its expression. This will include submitting manufacturing protocols to FDA as well as a general clinical design. And after these conversations are done, which will hopefully occur in the early fall, we'll be able to share all those results with you at the conference that a significant amount of the Grand Pharma team will be attending. And then our goal is to begin treating GABA-G2 loss of function kids in spring of 2027. So we are less than a year away from treatment for the community and for GABA-G2 specifically, and we are just so excited to finally help as many of you as we possibly can. And I look forward to seeing you all at the conference, and you'll see the rest of my team there. And thanks for tuning in for this update, and I will talk to you soon.
Thank you for sharing that information with our community, Tommy. And we are so excited that the Grand Pharmaceuticals team will be flying out to our 2026 Cure GABA-A Family and Scientific Conference this year in Orlando, Florida on November 6th and 7th. Now we will be having a Disney Day on November 5th, so there will be discounted tickets, and look out for information on our website. But this year's conference is going to be spectacular. We're going to be in a ballroom. We're going to be talking about all of the translational work that we've been working on over the last couple years, as in the GABA-A1 and GABA-G2 messenger RNA for loss of function therapeutic, our proof of concept for our beta-3 gain of function project, our proof of concept for our alpha-1 gain of function project, and there's so much more information that will be released shortly on our website. So we look forward to seeing you, and you can get those tickets on our website at curegaba.org. Bye.